Hello, I'm Lise Murphy. I'm a patient representative in a European reference network called VASCERN, and it's vascular disease, vascular and complex diseases. And I'm sitting here with Nordgren. So please, a few words about you.
So thank you for letting me come to this session. My name is Nordgren, and I'm a clinical geneticist. I'm a professor and a senior consultant in clinical genetics at Karolinska. And I have been working with rare diseases for the last more than 20 years.
Mm. And coming from a patient organizations, we've been really impressed by a session you have, a week-long session where you train physicians in rare disease. And I think this is a fantastic example, a best practice. So how did this initiative come about?
Well, I have been working with rare diseases for a long time, as I said, and I've met so many patients and families and also physicians, and I have realized how little knowledge most physicians have when it comes to rare diseases. And I've met the families, and I've realized the huge need of this to improve knowledge and awareness about rare diseases. So I have been the head of the Center for Rare Diseases in Sweden since 2012, and that was when I started this, as this was one of the most important things for me, was to work in different ways to increase awareness. And then we started this week-long course for residents in pediatrics and also in residents in clinical genetics. And we have been doing this since 2000, and I think we started in 2013, and we have had this course yearly since then.
Mm-hmm. Mm-hmm. I've been participating as a patient in one of the sessions, and you do that a lot. You do bring in patients, you bring in parents, but could you talk a little bit about the week as such, how you planned it, etc.?
Yes. Well, the first thing is that I think that it's extremely important to have patient involvement, because when you meet the patients, when you listen to the families, you understand in a much better way. So the first focus was to think of families and patients that we could ask to participate in this course. And we also, I wanted it to be focused on rare diseases in as a whole group. But we have, of course, not been able to cover the whole field within a week, but we have covered lots of different parts within the field of rare diseases. Like we have been talking about all different kinds of disease groups. We have had the syndromes, we've talked about intellectual disability, about the connective tissue disorders, about primary immune deficiencies. We also talk about the metabolic diseases, and we invite specialists. So for every, you could sort of divide it up to the different European reference networks, because that's the best way, I think, to develop the course, and that's to bring in the specialists from each field and then let them decide what to talk about, and also make sure that you have a patient representative that is active, at least one patient per session, sort of, when you talk about a specific field. So that's how we have, that's how I thought when I developed the course from the beginning. And also we wanted to have even more patient involvement, so we've had also a session where we have like a speed dating. You were also there.
Yeah.
You can tell us a little bit about that if you want, because it was during lunch that we met.
Yeah, and also I think because I was part of a lecture before that, so they already knew my story. They knew a lot about Marfan syndrome, which was the topic then. And then they had additional questions. So we were sitting around a table, and 3 times during lunch, there was a change of tables, so new ones came. And although we did not have an awful lot of time, but I found it was really rewarding, and it was good for me to ask them how they perceived this. And they said, you never forget a patient story. No. You can sit and read about, for example, Marfan syndrome in a book, and okay, you understand the medical background and all the facts, but it doesn't really hit home how it is to live with that disease. So it was also very good for me. It was rewarding for a patient to participate, I would say. Really interesting. Would you say that that is one of the success factors, that everybody is so happy to participate? What?
Yeah, definitely. I think that is the most important success factor, is the patient involvement and the possibility for the residents. Not only the residents, because there were also other specialists coming because they were so interested in this, to give them the opportunity to ask those questions that you never ask, and to really meet the patients. Because when you read about the rare disease, or if you read about the specific syndrome, they all seem to be almost the same. But when you meet the patients, you realize the huge differences, and you realize that there are different needs in every single diagnosis. So I think that the students were happy, the lecturers, I mean, like the organizers, we were extremely happy, and most of all, the most important, the patients that were attending were also very happy, and actually many of the parents and patients, they want to come back year after year, because it is rewarding for all of us. It's really rewarding. I mean, it tells you so much more than a lecture to be able to just sit and meet and talk to someone.
So we can agree on that it's a concept that really works. So what advice would you like to give if other universities, if they want to set up the same? Because, I mean, it can't have been that easy to start this. I mean,
we have tried, and we have changed the concept a little bit from year to year to try to improve it. But I think that the combination of trying to find the best experts that can give the lectures about the different diagnosed groups is extremely important. But then also the patients, and to involve them from the beginning and really talk to them about what we are doing, and let them also, the patient themselves, decide what they want to do, how they want to participate. Sometimes they want to be part of a discussion, other times they want to show slides in a PowerPoint, or just sit and answer a question. So it's different from person to person how they want to do it. And sometimes they bring their child, and sometimes they prefer just to talk or to show photographs. So I think the combination of experts, both patients and physicians that are like very interested and motivated. And then we also have quite a lot of practical work where we have like we give the students cases, and they have to look and study in different databases in order to know how to diagnose a patient and things like that. So the whole combination has been very successful, I would say. And I think that since there are so many different rare disease groups, I think that this course should probably be 2 weeks and not 1, because it's difficult to cram everything into just 1 single week. But it's possible to do it in a week also.
So is that a little bit of a thought for the future, that you want to expand the course?
I would like to expand the course. I think it's going we are going to do it in some way. And also, I think that since Sweden is a small country, we're about 10 million people living in Sweden, and 500,000 of those have a rare disease. So I think that we also need, since the rare diseases are so common as a group, we need to have more focus on rare diseases also during at an earlier stage when you are in medical school. I think we have to talk about rare diseases. We have to talk about the huge change that has happened during the last years when it comes to genetic diagnostics with the whole genome sequencing, when we suddenly have thousands of different rare diseases that are diagnosed. And since every diagnosis has its own disease phenotype, symptoms, you need to know how to find this information, to know what to do, how to help the patient in the best way. So it's extremely important, I think, that we have more education about these things. And it's not good to only have like genetics in one course, and then you talk about when you study pediatrics, then you talk about intellectual disability or so. I think it's very good to just have it all in one short time, that you realize that there are so many problems that patients have in common, and there are so many things that they can do in a similar way, the physicians, when it comes to diagnostics and so. So I think it's very good to give a course like this. I strongly recommend it, and I think that I want to keep on doing this and try to improve it a little bit every year.
And I could add that from the patient side, we really want an earlier diagnosis. And I mean, this is the problem for a lot of us, that we wait and wait, and we wander around in the medical healthcare system in our respective countries looking for an answer, and it takes far too long. So we waste resources, and it's strenuous for all parties.
Yes.
It's very frustrating, I think, for physicians to meet patients where they don't know how they can help this patient or not.
Yes.
Yeah, so we agree on this. Thank you very much.
Thank you. Thank you very much for